Listen for Here Today with Dr. Joanie Davis of Davis Family Hearing.
My name is Dr. Joanie Davis. Tune in where we will be discussing different causes of hearing losses, all the various different types of treatment options that exist, and how your overall health can be affected by not only hearing loss, but the improvement that you'll see when your hearing loss is treated.
Brought to you by Davis Family Hearing on JB Radio.
Davis Family Hearing offers a free 30-day hearing aid trial. The initial appointment is completely free of charge. We do a full hearing examination with one of our board-certified doctors of audiology, a consultation to address your specific lifestyle needs, and then a free 30-day hearing aid trial. At the end of 30 days, you can either return or purchase the hearing aids. Call us today at 352-666-8910 or visit us at davisfamilyhearing.com.
And good afternoon to you. Thanks for joining us. I'm JW. Glad you tuned in this morning, this afternoon, whatever the case may be. You're in tune to 99.9 FM, WXJB, and a program called Here Today, which, of course, is heard over the weekend as part of our Ask the Experts segment. That's Ask the Experts Weekend. And during Here Today, you get an opportunity to hear from one of our favorite doctors of audiology, our choice, Dr. Joanie Davis with Davis Family Hearing. They have 3 locations to serve you: Spring Hill, 19 in Weeki Wachee, and of course Newport Richey, the one in Spring Hill, of course, on Spring Hill Drive, and Newport Richey on Little Road. So those are all convenient for you wherever you may be coming from. She services folks from all up and down the Nature Coast, as well as the entire state of Florida, because they are the best. They are certified doctors of audiology. Dr. Davis, good day.
Good morning. How are you?
Wonderful. How are you?
Good. I guess it's a little later than morning now. I need to graduate to the afternoon.
There you go. Let's take it. I'll do it.
Lots and lots and lots of stuff going on, which is what makes our lives so fun.
Yes.
We'll go ahead and touch base on where Davis Family Hearing is in the community these days. Mm-hmm. This weekend, big weekend in Hernando County, lots of events. We are going to be at the Greek Festival all weekend long. So all day today until 8 o'clock at night, and then all day tomorrow as well. So feel free to stop by and get a free look in your ears and some earplugs and any sort of questions that you have. I'll have a doctor there as well as a front office person to schedule appointments. So we look forward to seeing everybody stop by. My office manager just got there and she texted me and said that we're right across from the wine table. So that's good placement. If you stop to get a glass of wine, turn around and say hi to Davis Family Hearing while you're there.
Well, I don't know. It's good news for the folks that are attending, but not good news for you.
Well, I think we'll be fine.
I'm just kidding. Yeah.
And then one other thing I wanted to talk about is actually last week I had a chance to go down and talk to the girls at Tampa Bay's Morning Blend from Channel 11 on ABC Action News. What a great set of people. I mean, just a cool set, and everybody was so nice, but I'm on there talking about hearing loss. Mm-hmm. And last week, I talked about how hearing loss can affect our relationships and how it's a hidden disability. And next week, I'm going to talk about the latest technology and hearing aids. So tune in January 31st at 10 a.m., Channel 11. It runs from 10 to 1, and I'll be on there talking to Miss Carly. She was such a jewel. She really was. And she's very interested because she had several family members affected by hearing loss, which is what I find. Everybody's affected by hearing loss in some way, shape, or form.
So those folks that have not had a chance to see you in your office or in the community now have a chance to put the face with the voice.
Exactly.
All right.
Exactly. I actually had a patient that started seeing me, I think it was like 10 years ago. And I had seen her at the previous practice that I worked at, and she couldn't find me. She wanted to know where I went. I treated her husband. And then she started to have some hearing problems, and she said that she was in the kitchen and she heard my television commercial come on, and she said, I knew that voice immediately. And I started laughing, but I saw her in my office and knew exactly who she was and remembered her, because when you come to Davis Family Hearing, you're like a member of the family. We remember all of our patients.
It's amazing.
Last event I want to talk about is February 8th. We're having a meet and greet with Advanced Bionics, a cochlear implant manufacturer. And I'm particularly excited about this one because we're doing something different. we're going to run 2 sessions, and they are from 10 to 11:30, and then we're going to do 12:30 to 2 o'clock, and there will be refreshments, and it's a very informal session. You can come and go as you please, so if you're a little bit late, don't worry. Feel free to come in, and we do ask for reservations just for the food, so feel free to call our office and let us know if you're coming. But the cool part about this session, and this is something I've really been trying to educate the community on, is I have a couple coming to speak from the Better Hearing Association. She has 2 cochlear implants, and he has 2 hearing aids. And they're going to talk about how hearing loss affects your marriage and your relationships. And it truly does. But these people are so sweet and so well-spoken, and it gives everybody a chance to see that they're not the only ones experiencing this.
Amen.
I think a lot of times whenever you have hearing loss, you attribute those arguments with your spouse as just regular marital arguments, and it's really not. People who have hearing loss have an extra hurdle to overcome. I always say men are from Mars, women are from Venus, add a hearing loss, and good luck, because we have enough miscommunications between men and women without adding a hearing loss to complicate matters.
It affects not only one, but it affects 2 in that situation.
It does. It affects everybody around you. It really affects your family. And I just had a couple in, really interesting couple. I'm very excited to see how he does. But he has a bone-anchored hearing aid on his right side. And now he's getting a cochlear implant on his left side. And his wife said something so profound to me a couple of weeks ago. She said, he's a really social guy, and he can't go out and have fun and go dancing with me because he doesn't enjoy it. And he can't talk to people because he just shuts down in background noise. So what's happening is she goes ahead and goes, and he stays at home. Yeah. So not only is he not getting to go, but they're spending time apart too, and that's not good for their relationship. So that's what this session is all about, to kind of air it out and talk about what we can do about it. Because the good news is there's a ton of treatment for hearing loss. When I went down to Tampa Bay Morning Blend, she asked me what my take-home message was for everybody, and I said my take-home message is there is a hearing loss treatment for everyone. I've never, ever, ever found anybody that we didn't have a solution for. And unfortunately, there are so many professionals out there that will tell people that there's nothing we can do about that ear, or nothing that we can do about that ringing in your ears or that tinnitus. And there is just so much that we can do. So don't lose hope, and come in and let's take a look at your particular situation, and we can talk about just how many options you have.
Good. A lot of information. Of course, once again, Dr. Joanie Davis in the studios with us. We hear from her the 2nd and 4th weekend of the month. So every other week right here on 99.9 FM, a program called Here Today. We're talking about your hearing issues. And who better to tackle that than doctors of audiology at Davis Family Hearing, and of course, Dr. Joanie Davis. So we've got a advanced cochlear seminar coming up February 8th from 10 to 11:30, and another one from 12 to 2. So you can make either one or the other or both.
Yes.
Okay. And of course, you're going to be at the Greek Festival, which is going on now.
Yes.
Okay. By the way, how'd the Bloodmobile go?
It went really well. We had a really good turnout for it. And I heard 3 days after they were at our location that they only had a 3-day supply of blood. So it's very needed right now. Honestly, this flu is wreaking havoc on the United States, and they really need that blood. So anytime you see the Bloodmobile out anywhere, if you can, stop by and give some donations.
Thank you.
It went really well. We had a good turnout. We had a lot of patients. Thank you to my patients. They just had appointments, and they stopped in and gave blood, which was really nice.
Very good. And you brought up a bad word, a 3-letter word, flu, which stands for influenza, which is short. But I'm glad you brought that up, because it's something I want to talk about. We're going to go to a break.
Okay.
And a couple more things I want to talk about. And then again, whatever you want to talk about today, of course.
We're never at a shortage.
Right, exactly. And of course, she's here for you. So whatever you want to talk about, just keep that in the back of your mind. And you can always contact her at her office, or one of her staff members, or of course, one of her social media avenues, either web page, Facebook, whatever the case may be. Dr. Joanie Davis and Davis Family Hearing, doctors of audiology, 3 locations to serve you. We'll be back right after this.
Try the Lyric hearing aid free for 30 days. Davis Family Hearing is the only Lyric provider in Hernando, Citrus, and Pasco County. The Lyric hearing aid goes in your ear canal and stays for 3 months. There's no changing batteries, no cleaning, and you can wear it in the shower and swimming. Call us today to try it free for 30 days at 352-666-8910 or visit us online at davisfamilyhearing.com. Are you a candidate for a cochlear implant? Sometimes hearing aids just aren't enough. If you're still struggling on background noise or hearing your loved ones when they're not looking at you, even when you're wearing your hearing aids, a cochlear implant may be an option for you. To find out, call Davis Family Hearing at one of our 3 convenient locations in Spring Hill, Brooksville, or Newport Richey, or you can visit us on the web at www.davisfamilyhearing.com.
And of course, on the website, you can find out where they're going to be and different events that they're involved in. Of course, a calendar of events and so on and so forth. So her website, once again, that is
davisfamilyhearing.com.
Thank you. And the phone number for their office, once again, 352-666-8910. A program called Here Today, every second and fourth weekend of the month, right here on 99.9 FM. I'm JW. Thanks for joining us. Okay, so you brought up influenza, flu, which is an epidemic right now, a crisis that's just spreading across the country like wildfire, and it seems to be worse this year. So one of my questions is, I know this affects our hearing. It's all tied in with nose, ear, throat.
Yes.
What are you seeing in your office? How does it affect people's hearing, and what can we do?
It's a very good question. I am seeing a flood of people coming in with either negative pressure in their middle ear or fluid in their middle ear. Because when you have a respiratory problem, you said everything is connected. That includes the lungs as well.
Okay.
And that's really what we're concerned about with this flu.
Right.
And what happens is, because things aren't getting cleared out as efficiently, the tube that equalizes the pressure in your middle ear, called your eustachian tube, doesn't equalize the pressure as efficiently because it's inflamed and it's irritated by this irritant. What you'll find is your ears pop very easily. And if that goes on too long, sometimes you can draw fluid and just get completely plugged up. Honestly, the number one thing that I'm finding to help prevent it, well, my new recommendation is for everybody to take vitamin D3, because I started taking it and it's really good for your immune system and a super B vitamin complex. But for your ear in particular, local wildflower honey.
That's right.
2 tablespoons a day does a good job of helping to clear that up. I usually get mine at Murphy's Market, but you can get them at flea markets and any sort of natural food stores in the area. It has to be local and raw. It has to be wildflower or green swamp.
Oh, cool.
The other thing that you can do is, if you want to help pop your ear, we call it the Valsalva maneuver. That was the guy's name that discovered it. If you hold your nose and swallow, that'll help clear it up. Any sort of chewing gum or Sudafed a lot of times will help clear it up. Any sort of antihistamine or nasal decongestant will help.
Well, let me stop you right there. What about holding your nose and blowing?
I never recommend that for one reason. You can do that, but if you're going to do that, you have to be very, very, very gentle. Because if you do start to have a buildup of fluid, or if you have a lot of negative pressure and you blow too hard, you can perforate your eardrum and you can get a hole in your eardrum.
Okay.
So I always tell everybody to swallow, because you're not going to blow out your eardrum if you do that.
I'm going to do it right now, okay? Here we go.
And after you do it, did it pop?
Yeah.
And then a lot of times you have to swallow after you do it to kind of equalize it again, because what it does is create positive pressure to help equalize that negative pressure.
And I don't recommend wearing earphones while you're doing it. Because I just did it.
And now you're plugged up in your right ear.
Exactly, yeah.
That's a valid point. So if you yawn or swallow, that'll eventually pop for you.
Cool. The reason I brought that up is there was always like mixed emotions or mixed information or misinformation, whatever you want to call it, about holding your nose and blowing.
Yeah.
I've heard several different things.
Well, it's effective. You just have to be gentle with it. It'll do the exact same thing, but if you blow too hard, you might cause some serious damage.
Okay.
So that's why I tell people not to do it.
Okay, well, sorry to stop you. What else you were going to say something else along with the flu.
No, you're fine. Well, what I was going to say is if that negative pressure doesn't clear up, even after the flu is over, you might end up with some fluid behind your eardrum, and antibiotics are what we use to treat that.
Okay.
If antibiotics don't work, I have some very good ear, nose, and throat surgeons and some otologists in the area that can put a pressure equalization tube in the eardrum, and that'll help drain the fluid out of your ear.
Cool.
I'm seeing a ton of people, and I'm also seeing a lot of people with outer ear infections this time of year, just because there's so many irritants in the air. And what that is an ear infection just in the outer part before you get to the eardrum. And the symptoms of that are severe itching. Sometimes it can be very painful, and a lot of times you'll notice a decrease in your hearing as well.
Yeah.
And the solution for that, a lot of times to ward that off, you can put a little bit of rubbing alcohol in your ear after you get out of the shower, and that helps evaporate any moisture out of there to keep the infection away and disinfect it.
Not with a Q-tip.
Not with a Q-tip. You just use a dropper bottle, or I've been known to use like measuring cups if I don't have an eyedropper. You just have to have good aim and have a towel on your shoulder. You put it in there and let it sit for a couple of minutes, and then just dry it out with a towel whenever you're done. And if that doesn't work, then there are some drops that we can prescribe. I have some very good ear, nose, and throat physicians, and even primary care doctors can prescribe these drops. We just let them know what they need to write the script for.
And not only is she good at what she does, a doctor of audiology, she's a mind reader, because you're bringing up all the topics, all the questions I wanted to talk about today.
Nice.
You brought up the flu, and you brought up prescriptions. I was going to ask you, what kind of prescriptions do doctors of audiology prescribe?
We actually don't prescribe medication.
Oh, okay.
I foresee one day in the future, I'm always thinking about the future of our profession, because it would be very nice if we could prescribe antibiotics for middle ear infections and some antibiotic drops for outer ear infections. But we're very quick at getting the script for you. Usually your primary care doctor can handle it, and we can call them and let them know what they need to write. Walk-in facilities obviously can, and we have several very good relationships with some ear, nose, and throat physicians that we can.
Oh, okay.
But I have a feeling in the next 5 or 10 years we'll be able to write those prescriptions. I think that's something that a lot of people don't know, is that audiology is actually a relatively new doctoring profession.
Oh.
The minimum requirement for an audiologist used to be a master's degree. And I think it was in the year 2000, the minimum requirement for licensure became a doctorate degree. So we're only 18 years into that. And I've had the pleasure of watching the profession progress. And we work very closely with other professionals who prescribe medication and perform surgery. And we do all of the diagnostic testing and then all of the rehab afterwards. So you can think of us as the hearing doctor is usually what people call us. But we do see all of those disorders in our office. And even if it's something that we can't provide the script for, we'll make sure you get where you need to be immediately to get it taken care of.
Very good. Very good. And of course, not only does she take the questions, she answers them. And always.
It's true.
Yeah. Well, some people avoid questions, sometimes, or they just don't have the right answer, or
sometimes people don't know what to ask.
Right.
I find sometimes people will come into my office and I'll say, "What can I do for you today?"
Yeah.
And they just look at me and go, "I'm here for a hearing test." And I'll say, "Well, what kind of problems are you having?" And we'll dig a little bit deeper. And that's the goal when you come in, is to find out who you are, what types of problems you're experiencing, because we're dealing with quality of life. Our goal is to improve your quality of life. And sometimes, especially when other family members and spouses come, we always encourage any family members who are interested to come, so we can talk about the family dynamics and how, the spouse is getting frustrated because they think that they're ignoring them, and they're not. And we can explain that. And a lot of times the general public doesn't know how to talk to somebody who has a hearing loss as well. And there are 2 rules. Once the patient is treated, this goes for all of the time, but once the patient is treated and we have made everything loud enough, if there happens to still be a little bit of residual distortion, simple things like just being in the same room when you're talking to them. Everybody thinks you should be able to hear through walls, and the reality is even normal hearing people can't hear through walls. Looking at the person so they can pick up on all visual cues, and so your voice is directed to them, and speaking just a little bit slower. We have a habit of speaking very quickly in our society now, and sometimes even normal hearing people have trouble understanding because people are speaking quickly. But when you have a hearing loss, your brain slows for processing of sound, and if you're speaking too quickly, it just can't keep up.
Okay, very good. Once again, a great answer from the doctors of audiology, Dr. Joanie Davis, of course, with Davis Family Hearing. We're going to take a quick break, and we'll be back right after this. JW here with Dr. Joanie Davis of Davis Family Hearing. Dr. Joanie, why select Davis Family Hearing as our choice for audiology?
At Davis Family Hearing, we only hire doctors of audiology because your hearing is one of the most important senses that you have. It truly connects you to your loved ones, and you want to be in the hands of the highest qualified professional that there is.
I understand that you have a free trial period throughout all of your locations in Hernando and Pasco County. Tell us more.
If you are interested in Davis Family Hearing's free 30-day trial, please give us a call at 352-666-8910, www.davisfamilyhearing.com.
Dr. Joanie, how do we find one of your Davis Family Hearing locations?
We have 3 convenient locations to better serve you. One located 1.5 miles south of State Road 50 on Highway 19. One on Little Road, about a mile south of 52. And one on Spring Hill Drive. Please don't hesitate. Call today.
And there you go. You've got all the information you need to call Davis Family Hearing about your hearing issues. 352-666-8910. We'll get you in touch with all 3 locations. Okay, so we were talking about the ear, nose, throat, and chest, your lungs all tied together, and how different diseases, especially viruses like the flu, can affect that, and the different prescriptions and doctors that you recommend or may have to see to get certain items. We'll let you continue from there.
That's a really interesting question, because I had an interesting case this week that kind of demonstrates how we know how to get you where you need to be.
Right.
Part of being an excellent audiologist is being connected with the professionals that you need to get them to. It's kind of like being a primary care physician almost.
Right.
We're in a very unique position to pick up on other disorders. And I actually had a friend, she had a family member who experienced a very severe bout of vertigo.
Wow.
And when I see that, I always think it's something simple like BPPV or benign paroxysmal positional vertigo, where we can treat it very easily in our office. And we're currently in the process of setting up a full balance system, balance diagnostic and rehabilitative program in our office. We're in the works because I'm getting enough demands that I know that there's a lot of people that need help. It's a hot topic because vertigo is very common. But I actually saw a patient that we think it's something called superior canal dehiscence. And what that is we have 3 semicircular canals in our inner ear, housed in our temporal bone. And they're made up of tissue, and they sit in fluid. And occasionally, due to pressure changes with illness, with this flu going around or any sort of respiratory infections, you can actually get a hole in one of those canals. And we need an excellent surgeon to go in and patch that canal. And I partner very, very, very closely with Tampa Bay Hearing and Balance down on Davis Island. And they're the best.
Davis.
Yeah,
Nice.
Davis Island. I know, I kind of like that, actually. It's just a natural progression.
There
but
you go.
They truly care. They treat my patients so well, and they truly care about my patients, and they're the best surgeons in the area. So if I have a surgery like that needs to be performed, I get them in immediately. And I have an open dialogue with all 3 surgeons. We email back and forth all of the time, and their office is so caring that what I think is really interesting is you walk in and you'll see a Bible verse on in the hallway, but they actually pray before they go into surgery every day. Every morning they start the day out with a prayer, and I think if that doesn't say just how much they care, I don't know what does.
That almost reminds me of Dr. Gill's
Exactly.
Works on Your Eyes. Yeah.
Yep, exactly. Just very, very caring, and you know, if a professional actually cares about you, that they're going to do the best job that they can for you.
Like the folks at Davis Family Hearing?
Exactly,
Yes.
exactly. That's who you want to go for. That's who you want to see. And I encourage you to come in and see us. We have 3 locations, one on Spring Hill Drive, just east of Linden, one on Highway 19, just south of the big gray dinosaur, and one on Little Road, about a mile south of 52. Any information you want to have about us, we have our YouTube channel up and running now.
Cool.
So we have all of our radio shows and TV shows and any videos up there. I have this great staff member who's super techie and doing all that for me. Obviously, Facebook.com/Davis Family Hearing. Instagram, Pinterest, Twitter, any sort of social media you can think of, we're out there. And of course, our website at davisfamilyhearing.com. We have an appointment request form on our website. So if you don't want to call, you can just enter that in and we'll reach out to you and get you scheduled. And any questions you have, feel free to just put into that form. All of those go directly to me and I either answer them personally or get them to the staff member who needs to answer them.
And insurance?
All insurances. We're providers for all insurances.
Okay.
There is no insurance that we don't take, so you don't have to worry about that. That'll be an easy transition for you.
And do you need to be recommended or what?
A referral?
Yeah. Do you need a referral?
Not always, but I always
Okay.
tell everybody it's a good idea. The HMOs do require a referral, so that's just kind of across the board, but it's always a good idea to get a referral. If you don't have it when you come in, we'll make sure that we reach out and get it for you.
Okay, look for Davis Family Hearing at the Greek Festival this week. And of course, in her offices, that's at the Spring Hill office, February 8th.
Yes,
Yeah.
correct. The
Okay.
Spring Hill Drive office.
And she's going to have a seminar there on cochlear implants, the only provider here in the Nature Coast. This has been Here Today on WXJB 99.9 FM. I'm JW with Dr. Joanie Davis. Tune in next time. We'll see you then.
Everybody have a great weekend.